Welcome to our pain assessment series, and today's topic is Critical Care Pain Observation Tool, CPOT. Now, pain assessment is one of the most important things that we do as nurses, and as it stands, the gold standard for pain assessments is the patient verbalization of pain. However, in our critically ill patient, we use our critical assessment or observation of our patient so we can attain a pain level for this patient. Now, CPOT has 4 domains that we look at. Number 1, we look at our patient's facial expression. Number 2, we look at our patient's muscle tension. Number 3, we look at our patient's body movements. And number 4, we look at our patient's compliance with ventilator support that the patient is getting for our orally intubated patients, or we assess for vocalization of pain for patients who are extubated. Each behavioral domain of CPOT has a 0 to a +2 score. So your patient can attain a grade of 0, meaning no pain, up to a maximum of 8, meaning very high pain for that patient. Getting a baseline for your tool assessment is important. So first, on assessing your patient, you will obtain a CPOT assessment of the patient at rest. Then afterwards, you will assess your patients while a procedure is being carried out. Now let us look at our first domain for a CPOT. We're going to look at our facial expression. Now you go in your patient's room and you are going to turn your patient. While turning your patient, there's no grimacing, no expression, patient is neutral, everything, the patient is calm. You'll assign a 0. Now, if your patient, while turning, your patient frown, or their eyes might be closed before they open their eyes, they tighten their brow, you will assign your patient a 1. If your patient start to grimace, where you can see tightening and clutching of the muscles of the face, you'll assign your patient a 2 for facial expression. The second domain that we'll be looking at is muscle tension. If our patient is relaxed, we will assign our patient a 0. If our patient has, a slight tension or rigidity to the body, then we assign them a 1. If our patient is very tense or very rigid, you're turning the patient and they're very rigid, then we'll assign a 2 for muscle tension for a patient if we observe this. Domain 3 is body movement. So if there is absence of body movement for your patient, you would assign a 0 for this. However, you need to keep in the back of your mind that no movement does not necessarily mean no pain. So you need to keep that. You need to let that register. No movement does not necessarily mean no pain. So anyhow, your patient is calm in bed, there's no movement, you're going to assign a 0 for your patient. If your patient is a little tense, protective towards an area, they might grab onto you're turning them and that patient might clutch the tummy, or they might grab onto the arm that you're touching, then you assign a 1 because that's a protective movement of your patient. If your patient is very agitated, very restless, pulling at tubings, pulling at the ventilator, attempting to get out of bed, you cannot complete a procedure that you started, then you assign your patient a 2. And our fourth domain we're going to be looking at is compliance with ventilator support. Now your patient is on the ventilator and the patient is being ventilated, patient is quiet, ventilation is good, everything is smooth, there is no alarming of the ventilator, then you assign your patient a 0. If your patient start to get a little restless, just a little bit coughing, that may trigger the ventilator to alarm. They might be a little fidgety, that sometimes can trigger the ventilator to alarm. Then you assign a 1 for your patient's pain score there. If your patient is biting down on the ventilator and there's asynchronous ventilation going on. What I mean by asynchronous ventilation is that the ventilator support that is set for the patient to get, the patient is not getting it. The patient is stopping it because the patient bit down on the ventilator tubing, so ventilation cannot take place. So you will have the ventilator alarming. That means the patient is fighting the ventilator, so you'll assign a 2 for this. So that is assessing the patients who are ventilated. For the patient who are extubated, you will look to see if they talk to you in a calm voice, and then you will assign them a 0 because we're assessing vocalization of these patients. So they got a 0 if they talk to you in a calm voice. If the patient is sighing, mourning, groaning, you assign them a 1. And if the patient is crying out, sobbing, really distressed, you assign them a 2. Now, this is it. This is how we do our CPOT assessment. Keep tuned for our mini series in pain assessment, and look out for our pain assessment in dementia. Subscribe, hit that bell, and don't forget to share.